This hospital right here is where I was born, and currently they don't do deliveries anymore. So they don't let people have babies here anymore, unfortunately, due to the amalgamation of this hospital with LHSC. This is why I say we need to bring back this hospital as a standalone hospital, and not just rely on UH and LHSC for healthcare. You guys have renovated this whole hospital. Why is it sitting empty? Why can't we use this hospital as a standalone hospital to add to the two that we have after you guys have ripped down the Victoria Hospital on South Street as well as the Highbury location? There's no reason why we can't use this hospital as a standalone hospital and bring back deliveries back to this hospital so that people can have children here. Now that it's been renovated, there isn't no excuse as to why you can't use this hospital. Yep, that's a new unit in Parkwood, but Parkwood's old. Parkwood needs outside renovations, and it hasn't been done yet. This hospital is older than me, and it needs outside renovations. It needs more than one adult change table in the whole hospital. It needs more staff, better security, and no homeless people living at the hospital, and rather house the homeless instead of letting them freeze to death on our streets. I'm a 32-year-old guy, and I'm paying out of my welfare money for somebody to have a coffee that's freezing to death on our streets. That's unacceptable, Ford. All while places like the Unity Project get lots of money and funding, and there's lots of PSWs there, and there's lots of PPE equipment there, and they're not even handing it out. The PPE is being locked up in like lock bolts, and people are being told no. This is the kind of stuff that we're dealing with here. People are getting mad because they're getting mad at the fact that they're getting told to leave while they're homeless and there's no place to go. I was at the hospital for 2 months, but I had a sick loved one there. There's people hanging out at the hospital that have no sick loved one, but they're there to get scripts from the hospital. And the hospital acts as drug dealers because they're keeping the whole thing going. Just like downtown. They work with Chapman's, they work with the drugstores, they work with the clinics to keep this all going, all because they don't want to incorporate natural medicine. They also have VON workers that are all stressed out across the city. They lack help too. They don't have very much help, and they have to look after a whole city of 500,000 people. And this whole notion of healthcare, of leaving our elders and sick people and disabled people in rooms, is not healthy. People are getting sicker. People are dying. Look at our downtown. That's a great example of how bad healthcare is. Wake up. You can sit there and say, oh, well, we're changing the CEO. We're changing the workers. Blah, 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 blah. We need to change the way the systems run. The way the hospitals run. And quickly. Because look what's happening. And don't say they don't get paid enough, because look at the vehicles that they're driving. The CEOs of the hospital gets paid more than the workers do. We're not all stupid.